It's 11 a.m. here in Seoul. I'm Oh Soo-young at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak in the nation. In just a few moments, we're going to cut into a briefing at the Sejong Government Complex with simultaneous interpretation available in English. We're going to go into the briefing room where Yoon Tae-ho, Director General of Public Health Policy, will be sharing the latest figures and updates with us on the COVID-19 situation in Korea. So he's going to tell us how many additional infection cases of COVID-19 there were, especially with the sudden surge of cases in Seoul's neighborhood of Itaewon. He's also going to tell us the latest death toll, and it looks like the briefing is just about to begin as he's taken to the podium.
First, we have Mr. Yoon Tae-ho with the briefing on the coronavirus outbreak here in the country. Let us now begin our regular briefing for May 18th, Monday. As of today, midnight, we have 15 new confirmed cases, and we have 5 related to the Itaewon Club cluster infection, as well as other community transmissions, and the rest are imported cases. And our total number of confirmed cases now stands at 11,065, and a total of 9,904 have been discharged following full recovery. And 898 people are in quarantine undergoing treatment, and we have conducted over 753,000 testings so far. And we have 1 additional fatality as of yesterday, and the death toll stands at 263. I extend my deepest condolences to the deceased and the members of the bereaved families. The government held a KCDC meeting this morning presided over by Health Minister Bang Neung-woo on the measures to deal with those who have retested positive for the virus, as well as the transition to the distancing in daily life. And Health Minister Bang Neung-woo has said that the religious centers, as well as the call centers, were prone to high infection rates. However, we have witnessed that through strict quarantine measures of disinfection and testing of the body temperatures, we have seen that these facilities have curbed the further spread of infection. And in dealing with these distancing in daily life, we also learned that this is very much effective in preventing further spread of the virus through the community. First of all, we also have an analysis of the risk of infection of the COVID-19 for the past 2 weeks. And we have seen that we have less than 50 patients a day for the past weeks. And we also set some of the criteria of the goals of reducing the infectious rate to 5%. And we have many other goals and purposes as well. And considering the effects and the outcomes, we will be deciding on the measures of social distancing, and the average of daily confirmed cases is about 14.8% on a daily basis, and we have 1 cluster infection, and our control over the quarantine is below 80%. And considering these complex and comprehensive figures, despite we have seen a cluster infection surrounding the Itaewon clubs, we analyzed that the rate of quarantine here in the country is at a controllable level. Therefore, we do not have a further change to our distancing guidelines. And going forward, we will continue to monitor the current status, and we will always respond swiftly to any of the changes in the outbreak. Next is following the confirmed cases of the Itaewon club cluster infections. In relation to this club, as of today midnight, we have 168 confirmed cases, and the visitors amount to 89, and the contacts of them amount to 79. We have conducted so far over 50,000 cases of diagnostic testings. Fortunately, we are seeing a stable number of on-day increase in the related cases, and there is not an exponential surge. However, we have already witnessed a first case of fourth-hand infection, and we have infections being witnessed in 11 other municipalities. Therefore, we still continue to be vigilant. And we also see the possibility of a silent spreader within our community. Starting from May 24th to April 24th to May 6th, if you have visited the Itaewon area, however you haven't been tested, please get tested as soon as possible. And we also ask the members of the public to abide by the quarantine guidelines strictly. And we will consider and monitor the outbreak of the past weekend closely, and we will make sure that there is no further infection spread. And starting from May 6th, we have been implementing the social distancing in daily life, and we have witnessed and carried out a crackdown on about 20,000 facilities of multi-use facilities, including religious facilities as well as the other multi-use facilities, and we have implemented 180 administrative orders, and we will continue with such a crackdown and inspection going forward. And in this process, we have identified that some of the facilities have breached our principle of guidelines, incling the wearing of the face masks and the writing of the entry log. And during the weekend, we will also we have continued to see that there were cases of the breaches of the quarantine measures, including mass gatherings and eating together. And however, on the other hand, there were also some religious facilities that were at the forefront of great compliance to the quarantine measures, including having a QR code of all entries. And starting from this Wednesday on May 20th, we will be opening schools from the high school seniors. And in Busan, we will also have expanded the use of flexible working hours for many public officials. And we will also do an inspection for the schools and the study rooms where it is frequented by students, and we ask these facilities to comply with the quarantine measures, including disinfection and ventilation on a regular basis. And please remember that some of the facilities that were frequented by people were able to curb the further spread by keeping up to the quarantine guidelines. And next is our measures or changes to the measures in dealing with those who have tested positive. And we have seen that there was a continuous increase in the number of those who have been tested positive, and we have been having a special inspection on them starting from 14th of April. However, the viral inspection and testings does not show that these people who have tested positive have high infectious rates of the virus. And going forward, we will be having measures and devising such measures to carry out and to deal with these to the people who have tested positive, and we will be amending the related guidelines. Moreover, those who have been retested positive are those who have been tested positive for the PCR measures after they have been discharged after testing negative. And the details will be announced at this afternoon briefing. And the KSDC, we also dealt with the measures of the sending of the cases or the foreign entrants using the KTX to each of the municipalities nationwide. And starting from April 1st, we have intensified our stronger measures for quarantine for our entries from foreign countries. And we also have cooperated with the municipal governments, and many of the municipal governments have dispatched their staff to the Incheon International Airport as well as to the KTX stations. However, as we see an increase in the prolonged outbreak, we have a stronger burden. And starting from May 20th, 20th, the central government will establish a comprehensive information center for foreign entrants in the station of Gwangmyeong, and we will have an effective transportation measure and guidelines for all of the foreign entrants to the country. And as we will be opening the schools for the seniors of the high schools starting this week, I believe there are concerns among the parents. However, we do not have a strong, clear timeline as to when the COVID-19 will end, and we cannot carry out daily lives with such halt. And considering the college entrance exam and the academic schedule, we cannot delay the school openings any further. And for the students to enable a safe and healthy environment, we need to cooperate fully together. And we have learned through the Itaewon club cluster infection that carrying out quarantine measures strictly will help us to curb the further spread or even delay the infections. And we have also experienced this, and we need to live by bearing this going forward. And going forward, continuing, we believe that there could be cluster infections and sporadic infections through the multi-use facilities, including religious facilities, and each and every one of us needs to stay vigilant, and we need to be responsible as the proactive quarantine agents. Thank you very much.
That was a live briefing from the South Korean health authorities. You just heard that. We just heard that there were 15 new infection cases of COVID-19, bringing the total to 11,065. There were also one additional death, bringing the total death toll to 263. Well, that wraps up our coverage of this morning's briefing. Thank you for staying with us, and we'll be back shortly with our regularly scheduled newscast at 12 p.m. Korea time. Bye for now.